Welcome to today's session. In this video, we'll be practicing mock exam questions focused on the BACB Ethics Code sections 3.1 to 3.4, which cover responsibility to clients, identifying stakeholders, accepting clients, and service agreements. These are essential guidelines for ensuring that behavior analysts act in the best interests of their clients, make informed decisions, and communicate clearly with all parties involved. By going through these mock exams, you'll strengthen your understanding of these ethical responsibilities. Let's dive in and test your knowledge. Mock Exam 1. A behavior analyst carefully assesses their workload and expertise before accepting a client with complex behavioral challenges, ensuring they have the resources and competence to handle the case. Which ethics code does this situation align with? 1. 3.1 Responsibility to clients. 2. 3.2 Identifying stakeholders. 3. 3.3 Accepting clients. 4. 3.4 Service agreement. Let's break it down. Option 1. 3.1 Responsibility to clients. This option is not correct. While the behavior analyst must act in the best interest of clients, this scenario specifically focuses on evaluating competence and resources before accepting a case. That's covered under a different ethical code. Option 2. 3.2 Identifying stakeholders. Also not correct. This code is all about identifying and communicating with stakeholders involved in the client's care, like family members or caregivers. It doesn't deal with the behavior analyst's decision-making process before accepting a client. Option 3. 3.3 Accepting clients. This is the correct answer. In this scenario, the behavior analyst is ensuring they have the necessary competence and resources to take on a challenging case. According to 3.3, behavior analysts must only accept clients when they can competently provide the necessary services. Option 4. 3.4 Service agreement. This option is not correct. Service agreements are important, but come after deciding whether the behavior analyst is competent and has the resources to accept the client. This scenario focuses on competence and workload assessment, not the service agreement. So the correct answer is 3.3 Accepting clients, because it emphasizes the importance of ensuring you're within your scope of competence and have the capacity before accepting a new client. Mock Exam 2. A behavior analyst is working with a child diagnosed with autism and notices that the child's aggressive behavior has increased since starting a new intervention. Behavior analyst realizes that the intervention may be contributing to the escalation. The parents are unaware of this potential issue, but trust the behavior analyst to make appropriate decisions. What should the behavior analyst do to best address this situation and act in the client's best interests? 1. Continue the intervention as planned and monitor the situation for another month. 2. Stop the intervention immediately and inform the parents about the concerns. 3. Modify the intervention to reduce the risk of harm and explain the changes to the parents. 4. Ignore the behavior and focus on the original treatment goals. Let's go over each option. Option 1. Continue the intervention as planned and monitor the situation for another month. This is not correct. If the intervention is potentially causing harm or contributing to increased aggression, waiting for another month could put the child at greater risk. Ethical practice requires immediate action to minimize harm. Option 2. Stop the intervention immediately and inform the parents about the concerns. This is a possible option, but it's a bit extreme. While stopping the intervention might prevent further harm, modifying it first could still be effective without the need for a full stop. This option might lead to unnecessary disruption in the child's progress. Option 3. Modify the intervention to reduce the risk of harm and explain the changes to the parents. This is the best answer. By modifying the intervention, the behavior analyst addresses the issue while still providing treatment. It's crucial to inform the parents about these changes, maintaining transparency and ensuring they are involved in the process. Option 4. Ignore the behavior and focus on the original treatment goals. This is definitely not correct. Ignoring the child's escalating aggression is unethical. as it fails to address a key concern related to the child's well-being. Ignoring the situation could lead to further harm. So the correct answer is option 3. Modify the intervention to reduce the risk of harm and explain the changes to the parents, because it balances addressing the immediate problem while maintaining open communication with the family. Mock Exam 3. A behavior analyst working in a school setting ensures that they identify all key stakeholders such as parents, teachers, and school administrators, and clearly communicates their respective roles before services begin. Which ethics code does this reflect? 1. 3.1 Responsibility to clients. 2. 3.2 Identifying stakeholders. 3. 3.4 Service agreement. 4. 3.5 Financial agreements. Let's review the options. Option 1. 3.1 Responsibility to clients. This is not the best answer here. While acting in the client's best interest is important, this scenario specifically focuses on identifying and involving stakeholders, which is more accurately addressed by another code. Option 2. 3.2 Identifying stakeholders. This is the correct answer. In this scenario, the behavior analyst is ensuring that they communicate with all key stakeholders: parents, teachers, and school administrators before beginning services. This aligns directly with Ethics Code 3.2, which emphasizes the need to identify and engage all relevant stakeholders and define their roles clearly. Option 3. 3.4 Service agreement. This is close, but not the best match. While a service agreement is important in outlining the responsibilities of parties involved, this specific situation is more about identifying and communicating with stakeholders, rather than the formal written agreement of services. Option 4. 3.5 Financial agreements. This is not relevant to the situation. Financial agreements relate to compensation and billing, which are not discussed in this scenario about stakeholder identification. Therefore, the correct answer is option 2. 3.2 Identifying stakeholders, because it highlights the need for behavior analysts to communicate roles and responsibilities with all stakeholders before services begin. Mock Exam 4. A behavior analyst has been working with a nonverbal adult client on increasing communication skills using a speech-generating device. After 6 months, the client has made minimal progress. The family expresses frustration and asks the behavior analyst to consider more intensive and restrictive interventions. The behavior analyst believes these interventions could cause distress to the client. How should the behavior analyst proceed to ensure they are acting in the best interest of the client? 1. Implement the more restrictive interventions as the family requests. 2. Refuse the family's request without further explanation. 3. Explain the potential risks of the restrictive interventions and collaborate with the family to modify the current plan. 4. Discontinue services since progress has been minimal. Let's review each option. Option 1. Implement the more restrictive interventions as the family requests. This is not the best course of action. While it's important to consider the family's input, implementing restrictive interventions without fully considering the potential harm or distress to the client would violate the ethical principle of do no harm. The analyst must ensure that interventions are safe and in the best interest of the client. Option 2. Refuse the family's request without further explanation. This is not correct. Refusing the family's request without an explanation could damage the collaborative relationship with the family. Ethical practice involves open communication and providing the family with clear reasoning about why certain interventions might not be appropriate. Option 3. Explain the potential risks of the restrictive interventions and collaborate with the family to modify the current plan. This is the correct answer. It ensures that the behavior analyst is transparent with the family about the risks of the more restrictive interventions and maintains a collaborative approach. By working with the family to modify the current plan, the analyst can address the family's concerns while still prioritizing the client's well-being and ensuring that interventions are appropriate. Option 4. Discontinue services since progress has been minimal. This is not the best solution. While discontinuing services might be necessary in some cases, This option doesn't address the need for collaboration with the family, or the possibility of adjusting the current plan before taking such a drastic step. Therefore, the correct answer is option 3. Explain the potential risks of the restrictive interventions and collaborate with the family to modify the current plan. Behavior analysts should always seek to balance the needs and input of families with the best interests of the client, while ensuring interventions are safe and effective. Mock Exam 5. A behavior analyst is asked to work with a client who has a rare condition they are not familiar with. They discuss the situation with their supervisor and refer the client to another specialist. Which ethics guideline does this reflect? 1. 3.1 Responsibility to clients. 2. 3.2 Identifying stakeholders. 3. 3.3 Accepting clients. 4. 3.5 Financial agreements. Let's review each option. Option 1. 3.1 Responsibility to clients. While this guideline emphasizes acting in the best interest of the client, which is a key consideration here, it is not the most specific answer. This situation more directly addresses whether the behavior analyst is working within their scope of competence. Option 2. 3.2 Identifying stakeholders. This option relates to identifying and communicating with relevant stakeholders. While important, it does not apply directly to this scenario, which is about making sure the analyst is competent to handle the case. Option 3. 3.3 Accepting clients. This is the correct answer. This guideline ensures that behavior analysts only accept clients whose requested services fall within their scope of competence and available resources. In this case, by referring the client to a specialist who has the expertise needed, the analyst is following ethical guidelines and acting in the best interest of the client. Option 4. 3.5 Financial agreements. This guideline covers how compensation and billing practices are managed, but it is not relevant to this situation, which is about accepting clients within the behavior analyst's scope of competence. Therefore, the correct answer is option 3. 3.3 Accepting clients. This reflects the ethical obligation of a behavior analyst to ensure they are competent to provide services and, if not, to refer the client to an appropriate specialist. Mock Exam 6. A behavior analyst is providing services to a child in a school setting and has communicated regularly with the teacher about the child's progress. However, the child's parents are unaware of the services being provided and have not been involved in the planning. The parents later express frustration about being excluded from important decisions regarding their child's behavior plan. What should the behavior analyst do to resolve this issue ethically? 1. Apologize to the parents and immediately involve them in the decision-making process moving forward. 2. Continue working with the teacher and update the parents occasionally. 3. Explain that the teacher is the most important stakeholder in this context. 4. Recess the behavior plan without informing the parents. Here's why. Option 1. Apologize to the parents and immediately involve them in the decision-making process moving forward. This is the correct answer. The parents are crucial stakeholders in their child's education and behavior plan. Involving them from the beginning is essential, and immediately including them in the process after acknowledging their concerns is the most ethical and professional course of action. It ensures transparency and collaboration, which are important components of ethical service delivery. Option 2. Continue working with the teacher and update the parents occasionally. This option is not correct because it still excludes the parents from the planning and decision-making process. Occasional updates do not fulfill the ethical obligation to fully involve all relevant stakeholders. Option 3. Explain that the teacher is the most important stakeholder in this context. This is not correct. While the teacher is an important stakeholder in a school setting, the parents have a primary role in decisions regarding their child's behavior plan and should not be excluded or minimized. Option 4. Recess the behavior plan without informing the parents. This option is incorrect as it continues to exclude the parents and violates the ethical standards related to collaboration with stakeholders, especially in important decisions concerning their child. Therefore, the correct answer is option 1. Apologize to the parents and immediately involve them in the decision-making process moving forward. Behavior analysts must always ensure that parents and other key stakeholders are involved in the planning and decision-making process for the client's behavior plan. Mock Exam 7. A behavior analyst is providing services to an adult client and identifies the client's legal, guardian, and other support staff as stakeholders, ensuring all roles are clarified at the beginning. Which ethics guideline applies here? 1. 3.1 Responsibility to clients. 2. 3.2 Identifying stakeholders. 3. 3.3 Accepting clients. 4. 3.4 Service agreement. Here's why. Option 1. 3.1 Responsibility to clients. This is not correct. While this code refers to ensuring the best interest of the client, this scenario specifically deals with identifying the stakeholders involved in the client's care, which is better captured under 3.2. Option 2. 3.2 Identifying stakeholders. This is the correct answer. According to this ethical guideline, the behavior analyst must identify key stakeholders, such as legal guardians and support staff, and ensure that their roles are clarified and communicated. By identifying these stakeholders and clarifying roles at the outset of the services, the behavior analyst is complying with this guideline. Option 3. 3.3 Accepting clients. This is not correct. This code pertains to accepting clients only within the behavior analyst's scope of competence and available resources. Although accepting the client is important, the question is focused on stakeholder identification, not whether the client was accepted appropriately. Option 4. 3.4 Service agreement. This is not correct. While it's essential to have a service agreement in place, the scenario is about identifying stakeholders, not outlining a service agreement. Therefore, the correct answer is option 2. 3.2 Identifying stakeholders. Behavior analysts must identify and clarify the roles of all stakeholders involved in a client's care to ensure everyone is aligned and informed from the beginning. Mock Exam 8. A behavior analyst is hired by a school to address behavioral issues with a student. After the initial assessment, the behavior analyst realizes that both the student's parents and a special education coordinator need to be considered stakeholders, but they have not been included in the discussion so far. The school principal insists that the behavior plan be implemented immediately, without the involvement of these other parties. What should the behavior analyst do to resolve the situation ethically? 1. Follow the principal's instruction and implement the behavior plan immediately. 2. Insist on involving the student's parents and the special education coordinator before proceeding. 3. Create 2 separate plans, one for the school and one for the parents, without discussing it with the principal. 4. Delay the implementation until the principal is comfortable involving all stakeholders. Here's why. Option 1. Follow the principal's instruction and implement the behavior plan immediately. This is not correct. While the principal is a key stakeholder, failing to involve the students, parents, and special education coordinator would violate the ethical principle of identifying and communicating with all relevant stakeholders. This could lead to miscommunication or issues down the line. Option 2. Insist on involving the student's parents and the special education coordinator before proceeding. This is the correct answer. According to 3.2 Identifying stakeholders, the behavior analyst must ensure that all key stakeholders, including the student's parents and the special education coordinator, are involved in the process. Ensuring their involvement will align the intervention with ethical standards and ensure the best outcomes for the student. Option 3. Create 2 separate plans, one for the school and one for the parents, without discussing it with the principal. This is not correct. Creating 2 separate plans would only cause confusion and inconsistency in implementation. Ethical practice requires clear and open communication between all parties. Option 4. Delay the implementation until the principal is comfortable involving all stakeholders. This is not correct. While waiting may seem considerate, the analyst should ethically insist on involving all relevant parties from the start. not delaying action based solely on the principal's preferences. Therefore, the correct answer is option 2. Insist on involving the student's parents and the special education coordinator before proceeding. Behavior analysts must ensure all key stakeholders are involved and informed before moving forward with a behavior plan. Mock Exam 9. A behavior analyst fails to document the involvement and responsibilities of a key stakeholder at the start of their professional relationship with the client. What ethical standard is being violated? 1. 3.1 Responsibility to clients. 2. 3.2 Identifying stakeholders. 3. 3.3 Accepting clients. 4. 3.4 Service agreement. Okay. Option 1. 3.1 Responsibility to clients. This is not the most accurate answer. While failing to document stakeholder involvement could impact client welfare, the main issue here is related to identifying and involving stakeholders properly, which is covered under a different code. Option 2. 3.2 Identifying stakeholders. This is the correct answer. According to 3.2 Identifying stakeholders, behavior analysts must ensure that all key stakeholders are identified, their roles clarified, and that these responsibilities are documented at the beginning of the service relationship. Failing to document this information violates this ethical guideline. Option 3. 3.3 Accepting clients. This is not correct. This code relates to ensuring that the behavior analyst is competent and has the resources to take on a client, rather than focusing on stakeholder documentation. Option 4. 3.4 Service agreement. This is not correct. While a service agreement involves outlining the terms and conditions of the relationship, the ethical issue here specifically concerns identifying and documenting the roles of key stakeholders. Therefore, the correct answer is option 2. 3.2 Identifying stakeholders. Behavior analysts are ethically obligated to identify and document the responsibilities of key stakeholders from the start of the professional relationship to ensure transparency and effective collaboration. Mock Exam 10. A behavior analyst accepts a client whose needs fall outside their scope of competence without taking steps to discuss or resolve this with relevant parties. Which ethical standard is being violated? 1. 3.1 Responsibility to clients. 2. 3.2 Identifying stakeholders. 3. 3.3 Accepting clients. 4. 3.4 Service agreement. Okay. Option 1. 3.1 Responsibility to clients. This option isn't the best fit. While the behavior analyst's responsibility to the client is crucial, the specific issue here is about accepting a client without having the competence to handle their needs, which is directly addressed in another code. Option 2. 3.2 Identifying stakeholders. This is not the correct answer. Identifying stakeholders is important, but the issue here is about competence, not stakeholder involvement. Option 3. 3.3 Accepting clients. This is the correct answer. According to 3.3 Accepting clients, behavior analysts should only accept clients when they have the competence and resources to meet the client's needs. If a case falls outside their scope of competence, they must take steps to resolve this, such as seeking additional training, consultation, or referring the client to someone more qualified. Failing to do so violates this ethical guideline. Option 4. 3.4 Service agreement. This option is not correct. While having a service agreement is important, the violation here concerns accepting a client outside the scope of competence, not the terms of a service agreement. Therefore, the correct answer is option 3. 3.3 Accepting clients. Behavior analysts must ensure that they have the appropriate competence to work with a client or take steps to resolve the issue before accepting the case. Mock Exam 11. A behavior analyst receives a referral for a client with severe aggression. The behavior analyst has extensive experience in behavior analysis, but limited experience dealing with severe aggression cases. They are unsure if they have the necessary skills to address the case effectively. What should the behavior analyst do to handle the situation ethically? 1. Accept the case, as their general experience should be enough. 2. Consult with a more experienced colleague and accept the case if they agree to supervise. 3. Accept the case but refer to resources to learn how to handle severe aggression. 4. Decline the case and refer the client to a specialist in severe aggression cases. Okay. Option 1. Accept the case, as their general experience should be enough. This is not correct. While the behavior analyst has general experience, it is essential to have specific competence in dealing with severe aggression. Assuming general experience is enough without proper supervision or training could put the client at risk. Option 2. Consult with a more experienced colleague and accept the case if they agree to supervise. This is the correct answer. According to ethical guidelines, behavior analysts can seek supervision from a more experienced colleague if they are unsure about their competence in a specific area. By having the experienced colleague oversee the case, the behavior analyst ensures the client receives appropriate and effective care, while also maintaining ethical standards. Option 3. Accept the case but refer to resources to learn how to handle severe aggression. This option is not sufficient. While learning more about severe aggression is important, this does not immediately ensure the behavior analyst is equipped to handle the case effectively. Additional supervision or guidance from a more experienced colleague is necessary. Option 4. Decline the case and refer the client to a specialist in severe aggression cases. This could be an ethical decision, but it's not the best option in this situation. If the behavior analyst can receive supervision from an experienced colleague, they can ethically continue to work with the client. Referring the case immediately may not be necessary if adequate supervision is available. Therefore, the correct answer is option 2. Consult with a more experienced colleague and accept the case if they agree to supervise. This ensures the behavior analyst is acting ethically by acknowledging their limitations and seeking the appropriate support. Mock Exam 12. A behavior analyst develops a behavior plan that ensures the strategies used are safe and beneficial to the client, avoiding any interventions that might cause harm. Which ethics code is being followed? 1. 3.1 Responsibility to clients. 2. 3.2 Identifying stakeholders. 3. 3.3 Accepting clients. 4. 3.4 Service agreement. Okay. Option 1. 3.1 Responsibility to clients. This is the correct answer. Behavior analyst is acting in the best interest of the client, ensuring the behavior plan is both safe and beneficial. This aligns directly with the ethical guideline in 3.1 Responsibility to clients, which emphasizes acting in the client's best interest, maximizing benefits, and avoiding harm. Option 2. 3.2 Identifying stakeholders. This is not correct. While identifying stakeholders is important, this option refers to understanding who is involved in the client's care, not about ensuring the behavior plan is safe and beneficial. Option 3. 3.3 Accepting clients. This option is not correct. 3.3 Accepting clients focuses on ensuring the behavior analyst has the competence to work with a client, but it does not address the specific requirement of ensuring safety and avoiding harm in the behavior plan. Option 4. 3.4 Service agreement. This option is not correct. While service agreements are essential for outlining roles, responsibilities, and services, it does not directly deal with the specific actions involved in creating a safe and effective behavior plan. Therefore, the correct answer is option 1. 3.1 Responsibility to clients. This code ensures the behavior analyst's primary focus is on the client's well-being by using safe, beneficial strategies. Thank you for joining today's session. We hope these mock exams helped you sharpen your understanding of Ethics Code 3.1 to 3.4. In our next video, we'll continue practicing more scenarios to deepen your knowledge of these important ethical guidelines. If you found this video helpful, don't forget to press like and subscribe to stay updated on future sessions. See you in the next video.